challenge is on treating chronic pain through the use of intrathecal drug delivery.
So, in 2019, the CDC reported that 20.4% of US adults suffer from some form of chronic pain and 7.4% experience what's known as high impact chronic pain. The cost of this is estimated to be about $560 billion when accounting for both the medical costs and the missed workdays, and upwards of 30% of terminally ill patients, including those suffering from some form of terminal cancer, report that they haven't found any adequate pain relief.
Our method for treating chronic pain in cancer patients for whom more traditional methods did not work is through the use of intrathecal drug delivery. Intrathecal drug delivery uses a catheter to deliver pain medication directly to the spinal cord, which requires fewer doses and results in fewer side effects due to the fact that it's targeted. There are a few devices on the market that do this currently, but they do not work for all patients. It's also been shown that electrical stimulation to the spinal cord in the epidural space can lessen pain in some patients. So we had the idea to combine the two. Both are implanted devices, and in studies where patients had both devices, it has been shown that they had less pain than using one or the other. So our idea is to combine the two in one device and therefore one surgery. Our diagram is on the right, and it shows the device along with the catheter and the electrodes, as well as some changes we make to it. The device itself is a small disc that is implanted in the abdomen with an intrathecal catheter that goes up the intrathecal space of the spinal cord. Meanwhile, the electrodes go to the epidural space in the spinal cord to provide pain relief at two different locations. So there were also some changes that we decided to make to the traditional intrathecal drug delivery device. One major problem is there is a migration disconnection of the catheter, so we have improved the catheter connection with a latch. Another one is a device pocket infection, so we have devised an antimicrobial coating that is a sol gel loaded with vancomycin to prevent Staphylococcus aureus infections. And sometimes at the tip of the catheter, an inflammatory granuloma will form due to high morphine use. So we've devised a catheter cap to further spread out and lower the concentration of morphine in one spot that results in the inflammatory granuloma.
When looking at the benefits of intrathecal drug delivery compared to transdermal and oral opioid use, we see that a lot of patients either eliminated or are limiting their opioid use for pain management. When opioid use is limited, this reduces the amount of spending on those pain management drugs. There are still costs for our current treatment, but the overall spending is definitely going to be less. Intrathecal drug delivery also decreases the long-term dependence on opioids, which would increase the patient's quality of life. Other factors that have been linked to a better quality of life on intrathecal drug delivery include decrease in pain levels and an increase in physical conditions and physical abilities of the patient. When we look at the benefits of intrathecal drug delivery combined with spinal stimulation, we see that 91% of patients in a specific study actually enjoyed the treatment and had recommended it to others. And 100% of the patients had continued treatment upon a follow-up check-in, and they said that they had experienced a better quality of life as well.
As explained earlier, chronic pain is expensive to treat in the United States, and that of course comes at high individual cost to the patient. While in the first year, intrathecal pain pumps may be more expensive due to the device and the surgery, they pay for themselves in 2 to 3 years and even start saving patients money over traditional methods due to the reduction in hospital and doctor's visits, as well as the lower pain medication dosages needed. It has also been found that electrical spinal cord stimulation helps patients either get back to work or find new work due to the reduction in pain. We propose that with a similar cost to intrathecal pain pumps with the added benefit of getting patients back to work, patients will be in a better financial position after their chronic pain is mitigated.
Patients who suffer from severe and chronic pain typically use oral and intravenous medications for their pain. Unfortunately, these do not always give them the desired effects, or they have unwanted side effects. There are other intrathecal pain pumps currently on the market, these including the Medtronic Synchromed 2 and the Flowonix Prometra 2. Unfortunately, these have some issues that come with it, including inflammatory masses or infection or catheter disconnection. But there are currently no devices on the market that provide both the spinal stimulation and intrathecal drug delivery.